Hi everybody, it's Lorraine from Lorraine's Says Women's Health, Fitness and Wellness, and today's coffee chat or tea or glass of water, mummy break anyway, we're going to be discussing all the P's. So we're going to look at pelvic floor function and health during pregnancy, postnatal, and then perimenopause. So I want to give you quite a lot of information in quite a short period. So tips and kind of solutions, I guess, and what you need to be looking out for through those transition years. Okay, we should also be very mindful pre-pregnancy as well and going into a pregnancy on how our pelvic floor muscles are functioning, if they're functioning well, and then throughout pregnancy, how we need to look after them, maintain their function. Postpartum, same again, what to look out for. And then just because we've finished breastfeeding, having babies, it doesn't necessarily mean we can forget about our pelvic floor muscles and they're going to be good to go for the next 20 years or so, because then the different changes happen through perimenopause and menopause that rapidly can start to affect how well the function is of that group of muscles. All right, so what do we need to look for from the start? All right, so from the start in pregnancy, maybe your pelvic floor muscles are just something that you don't even think about. You know, we can run, jump, we can go to trampolining, we may have been athletes, carry-lifting, and pelvic floors is just something that we've never, ever had to think about. They're automatic. They're working functionally and how we should do. So when we laugh, etc., no need to worry about leaking ourselves. So kind of that's pre-pregnancy for most of us. Obviously, some sports, and there may be some different issues in pelvic health that can crop up. And again, this is something what you need to take for the next 20 years. Okay, so things like endometriosis, polycystic ovaries, prolonged use of the pill, intense sports, etc. They can all have an effect on the function of our pelvic floor muscles. Hypertonic pelvic floor muscles, which we will discuss. And again, through pre-pregnancy and before you going into pregnancy, all you need to do is know about your pelvic floors, know about your pelvic health, because it's going to help you when things start to quite dramatically change, and then depending on our birth. So ideally through your pregnancy, it's great to find out if you have normal pelvic floor muscles, high tone pelvic floor muscles, and check your pelvic health. Throughout our pregnancies, again, what we need to look at is possibly, if the function is good, we then need to look at preparing the pelvic floor muscles to push and for birth. So really getting to know how things feel and how things even look down there. You know, we can be squeamish about things like that, but if you know how things feel and look through your pregnancy, then again, with any instruments used, second, third degree Turing, you can check things and know what's possibly not right, and it gives you the first instance to know that you need to go and see a professional. So that's in pregnancy. Postpartum, with the feedback we've learned from the pregnancy, we can start to gather a clearer picture of if our pelvic floor muscles have been damaged post-birth, how things are feeling, what we should expect, how things shouldn't feel. And don't forget also as well, through this postpartum bit, we need to look at seeing a postnatal pelvic health physio, so she can check internally. Always get your LMCs, which is your midwives, your lead maternity carer, to check. I know it might not be a great time, but get them to check your stitches. They are the first people there to see you and to assess, and then hopefully refer you on. Knowing again how things feel. So going back to that, also as well, which can be kind of instances what's happened through your birth for red flags as to if there is going to be pelvic floor damage there. So red flags can be big baby, very, very fast delivery where you've not been able to control it, instruments used, so forceps, and then of course your degrees of tearing, how long you've pushed for, and age can be a factor as well. So you've got to take all that into account. And it's not just for those first initial months postpartum. It's the entire time that you're breastfeeding that you need to be aware of your pelvic health. And again, one of the main things I would get to assess is if you've got low or high tone postpartum. Then, okay, great, we may have a few couple of years, or do we? What I often always suggest to mums is kind of use the programs for the 3 to 5, even 6 months, and then forget about them, go on to something else, which is all great. But in our Birth to Fit Mum program, especially, there's maintenance exercises which you can be doing for the rest of your lives, and which we kind of should be doing. So we've always got that good connection to our pelvic floors and cores. And so that's ideal. Going to prevent pain, pelvic floor dysfunction, back and hip pain, knee pain, etc. A lot of injuries postpartum can come from having the weaker core muscles. And again, it's just something what we don't kind of maintain or come back on once we think we're recovered and okay. So as we start to get older, finish breastfeeding, etc., we're getting into our late 30s, early 40s, we may start to see some hormonal changes. Our body's cellular repair doesn't happen as quickly enough, so we start to see a reduction in the connective tissue in our skin. And we see that in our faces with increased wrinkles, etc. And that's kind of what's starting to happen to our nice pelvic floor muscles. So they're starting to lengthen out and get a little bit weaker, which is why we start to come into this next phase of an increase in prolapse as we start to age. So again, being mindful of your pelvic floor activation, function, high tone versus low tone, exercises that you need to do. And we also need to look at, the sports, what we're doing as well, and what the risks are, how we breathe and connect, how we initiate our activation cues. So when we're, doing housework, etc., heavy loading, shopping bags, etc., have we got our cues in place so that we know when there's a demand on our pelvic floor and core that those muscles are activated again. So that's pretty much today's get your head around your pelvic floor throughout the 3 Ps. That's, pregnancy, postnatal, and perimenopause, what to look out for, what to keep doing. Always make sure that you have a pelvic floor health specialist number at hand or a referral. Definite. It's one that you should have right from prior to getting pregnant with your first. Keep that on hand, and if they change, etc., get a different referral. Excuse me. Also look at irritations through nutrition. All those stimulators, your adrenal stimulators, how they can affect your pelvic floor muscle function, alcohol, caffeine, sugar, etc. Look at your water intake. Reducing water intake can irritate your pelvic floor muscles and still make you feel like you want to go. So we need to be aware of our nutrition as well. But any questions, let me know. Also, make sure that there's a program. We have a program for everybody here on our website, on the main website, which is pregnancyexercise.co.nz. So whether that's pregnant, postpartum, super fit mum, Fit Mum Power Core, we have the free 8-week guide, which is your pause fit for those of us who are over 40. So I hope you enjoyed today's session. Like I said before, any questions on your pelvic floor, health, guidance, etc. throughout the 3 Ps, place it down in the comments and I will gladly ask and help you guys. Bye everybody.